Hi, everybody. Thank you all for joining us today for our virtual meetup, Strategies for Post-Pandemic Virtual Care with Force Therapeutics. My name is Daniel Mintz. I'm the Chief Data Evangelist here at Looker. I'll be your host and moderator for today's presentation. And with me today, I'm delighted to have Ruth Sun, who's the COO at Force Therapeutics. We'll be discussing how Force delivers a patient engagement platform that maximizes the quality of virtual care while maintaining cost efficiencies. We're just about to get started, but before we do, I wanted to go over a few quick housekeeping items. First off, we will definitely leave plenty of time at the end of the presentation, 15 or more minutes, for questions and answers. So if you have a question for Ruth or for me, but they should probably be for Ruth because she's far more interesting, go ahead and type your question in the Q&A box and hit send, and that way we'll have it for us at the end. We'll do our best to answer all of the questions at the end. But you should know that, we may be able to get back to you by email if we're not able to get to your question today. The presentation is being recorded, and we'll send out a recording after it's over. So if you have to drop for some reason or want to go back and listen to a particularly insightful thing that Ruth says, you'll definitely be able to do that on the recording. I'll also just note that the windows that you see on your screen, they're all customizable. So you can minimize them, maximize them, move them around, however you see fit. And if you accidentally minimize or close a window, don't worry, just click the toolbar menu on the bottom and bring it back up. And with that, let's get started. So as I said, my name is Daniel Mintz. I'm Looker's Chief Data Evangelist. Looker is Google Cloud's enterprise BI platform, business intelligence platform. And we're really focused on helping people get more value from their data, get insight from their data. And a big part of our business these days is working with healthcare companies of all stripes. For anybody who's in the healthcare industry, you know that there is not sort of one set of healthcare data or one type of healthcare data. There are an enormous number of healthcare data use cases, everything from pharmaceuticals and distribution on that side to clinical trials to insurers to direct patient care, and electronic medical records, and on and on and on. So it's always interesting for me to get to talk to somebody from one particular sphere of the medical industry who is using data in a really insightful and new way, because I end up learning a lot. Looker works with a whole swath of companies across really every industry you can imagine and in every department. But I think the stories that come from specific industries, specific departments in those industries, that's really what drives our interest in these events, because it allows people to see what is actually being done with data on the ground. And so, as part of Google Cloud, which we've been part of officially for about 4 months now, it's just been fascinating to get to talk to all of these different companies that are using data in really amazing ways. And of course, the elephant in the room, as it were, the sort of rapid, incredible change that societies across the globe are undergoing right now because of the pandemic, because of COVID-19, has really driven, I think, an increased interest in using data to make better decisions. And for a lot of companies, that comes from this idea that the world that they lived in, while ever changing, was changing at a sort of predictable pace. And so when they were making decisions, of course, they, as they could, were looking at data to help them inform those decisions and make better decisions. But they had, a pretty sizable chunk of that decision making rested on their gut instinct, on their deep experience in their industry and what they were able to do over the past. And so they could rely, if you're a retailer and you're coming up on, on July 4th, we're going to need to, buy more barbecues. We're going to need to have more briquettes. We're going to need to buy the kinds of things that people are going to barbecue, because we know that people are going to come into looking for those things. And you don't need data to tell you that. Maybe you want to look at data to see exactly how much to order, but that pattern is pretty predictable. But over the last 4 months, the patterns have really gone out the window. People are buying all different kinds of new things. They're, dealing with healthcare in an entirely new world, whether that's actually dealing with the pandemic, with COVID specifically, or really any kind of healthcare where the risk calculations that people did in the past have have just changed dramatically. The social distancing that so many people are trying to adhere to really puts new demands on all kinds of businesses. And so the ability to look to data from right up to the minute that tells us how is the world changing and how is that affecting our business is absolutely critical to adapting to this new reality. And so with that, I'm going to bring in Ruth, who I'm so excited to get to talk to. I'm going to ask her just a few questions to get us kicked off, and then she's got a nice presentation about what exactly Force is doing, and then we'll go to Q&A. So welcome, Ruth.
Hey, Daniel. How are you?
I'm good. How are you?
I'm doing awesome today. Bright and sunny, and hopefully we'll get some time in the pool this afternoon.
That sounds lovely. It is, I think, 500 degrees feels like 800 degrees here, so I wish that I had a pool that I could jump into. We're going to hear a bunch about sort of what Force Therapeutics does, what you all are up to. But before we do that, I just wanted to ask a couple of questions about you and your career trajectory. You're a COO, so you're in the sort of operations sphere, and you're a COO at a healthcare company. And I'm curious, I think there are people who fit that description, who are in operations at healthcare companies, who probably don't think of themselves as somebody who works closely with data. So I'm curious, first of all, do you think of yourself as somebody who works closely with data? And if so, how did that come to be? Like, when did data become part of your career?
Yeah, that's such a great question, Daniel. I appreciate you asking. So I am a healthcare operations leader, but I am a technologist at heart. I've spent my entire career over the past span of 20 years in technology. And the role of technology, and more importantly, data and actionable insights in order to really impact healthcare in a meaningful way is so critical. It's part of the fabric of everything that Force Therapeutics does, really for three fundamental reasons and some of the core issues that we are looking to address and partner with our healthcare clients to execute on, right? Which is, one, how do we partner with the respective stakeholders in healthcare to drive high quality, meaningful care? Two, do that in a way that effectively weaves together all the stakeholders, whether they are consumers, payers, or providers. And there's a litany and very bifurcated ecosystem of individuals in all of those areas. And then finally, do that in a sustainable way that's consistent, right? Consistent in a way that matters to the consumer, you and I, as we look to get care, recover as efficiently and effectively as possible, as a provider, as they're looking to operationalize their businesses and drive efficiency. And obviously as a payer, because they're most motivated on how do I do this as effectively as possible, but at the lowest cost, right? And so how do I bend the cost of care on a sustainable basis? In my mind, in the DNA of the Force Therapeutics team as a virtual care platform provider, data is core and part and parcel to all of that, right? And so, we are honored and pleased to work with hundreds of thousands of patients, hundreds of physicians, and have aggregated millions of insights because of the work that we do in first focusing on those outcomes, coupling that with meaningful, sustainable virtual care, and then leveraging the insights that we derive with Looker and Google on our platform to continuously improve the quality of care.
Very cool. So, I know, at least here in the U.S., I think healthcare has a probably well-earned reputation for being sort of a slower adopter of technology. At least, medical technology is its own thing, but specifically on the sort of IT side, right? And there are good reasons for that sort of that slow and methodical pace of adoption. But I'm curious, you've been in the healthcare industry for quite a while, right?
Yes. Well over a decade.
I don't want to put you on the spot. Yeah, okay. For a while. I don't want to date you. But for a while, you've been in and I'm curious, sort of, have you seen, has there been a moment of a sort of pivotal moment where you really saw adoption tick up, or has it just been sort of a slow and steady increase? Obviously, Force Therapeutics is founded in a way, sort of as a company that is specifically around this question of technology adoption for particular kinds of patients. But I'm curious if over the years that you've spent in the healthcare industry, you've seen a real change.
Yeah, so the rate and pace of technology adoption to be applied in a meaningful way in healthcare has definitely accelerated in the past few years, to be totally honest, in the past 3 months, right, as we've been in the middle of the pandemic. When we founded a company, and we were founded by a clinician a decade ago, we started with the very fundamental thesis of, I need to deliver better care to my members, my consumers, and do it in a way when 90% of the time they are physically not in the four walls of the health system in front of me, right? And so we started our business very much focused on how do we maximize that care, how do we do that in an extended, personalized way, both before and after a consumer comes to the office. Speed forward now, 10 years. We've had the benefit of technology adoption at scale. 93% of consumers, regardless of their age, use technology every day. Our average patient is 67 years old, and we have well over 90% engagement on the platform. That's really part and parcel because how technology has become core to how we all live every day, right? And then most importantly, during the pandemic, when virtual care has really only become the only option, unless you're literally on your deathbed, we've been really honored that so many health systems, not just the ones that we currently partner with, but so many more in the past 90 days have onboarded with us because they all need, it's not a nice to have, it's a need to have with a trusted, proven, clinically substantiated platform at scale that can get up immediately, engage with consumers immediately, and then deliver the insights from our engagement to continually optimize and improve care.
Yeah, absolutely. No, you made a number of great points. I mean, I do think you can't discount the impact that people's sort of comfort with technology just in their normal everyday lives impacts what people expect technology-wise when they come into the healthcare system, right? That, since we all carry one of these around in our pocket now, that just changes the expectations when somebody comes to the doctor's office or needs to follow up with the doctor after, an engagement, that they say, well, I have this magical, amazing computer in my pocket. Like, surely I should be able to do something with this to communicate with my doctor, right? And as you pointed out, particularly for a population that is older and so didn't grow up with that technology as, my kids, you put a piece of technology in front of them and they magically know how to use it. It's kind of amazing. When my parents get stuck, I'm like, oh, I'll put my 7-year-old on and she'll show you how to use it because she taught herself in 4 minutes, right? But for a population where that's not the norm, where people are, it's something that they picked up later in life, that necessarily means sort of a slower rate of adoption. And so thinking about how that impacts the healthcare system and the expectations of that population when they go into the healthcare system, I think is a really interesting thing to think about, just, because I think it's easy, and I suspect people in healthcare and healthcare IT know this probably better than anybody, but I think there's a mistake that people make to think, well, you pick the right technology and you bring in the right technology and that changes everything. It fixes the problem that you were trying to solve. And the reality is that, technology and technology adoption is as much about people, maybe more about people and change management, and thinking about how technology plays into people's everyday workflows as it is about the underlying technology. You can pick the best technology with all the right bells and whistles, but if nobody understands how to use it and nobody's motivated to actually put in the time to learn how to use it, it's shelfware, as they say, right?
Yeah, I could not agree with you more. I mean, technology for technology's sake never works, right? Technology at the end of the day is a means to the end of, having a clear view on what are the outcomes, what is the value, what is the impact that is required in a given industry or client set, and then leveraging technology and the insights associated with it in order to execute that with much more operational efficiencies, with a lot more consistency, and then, in our situation, partnering with our health system to really minimize the variations of care, because one, it counts from an outcome standpoint, two, it counts from real dollar standpoint, and, our 70-plus medical academic research papers have validated and substantiated that over the past decade. And so, I could not agree with you more on, technology on its own means nothing. That's part of the reason why, quite honestly, 99% of health techs don't deliver as promised, right? Because the focus does not start with what is the end game, what is the real value, what's the sustainable impact, how do you clinically validate that with this over a sustainable period of time, and then apply technology to enable it, right? And so, we've been so pleased with our ability to leverage and continually iterate and improve the platform as we've partnered with the health systems, and then further enhance and weave that in as we look at best-in-class data platforms and insight platforms so that we can be much more agile in the work that we continue to do every day.
Cool. I think that's actually a great bridge, talking about starting with the business problem that you're trying to solve and thinking about, okay, how can we bring technology to bear on this problem rather than starting on the other end of like, wow, that's a neat technology. I wonder what cool stuff we could do with it, right? So I'd love to hear your presentation to understand more about sort of what is the business problem that Force has set out to solve, and how have you used technology and data like Looker, or data tools like Looker, to actually attack those problems and make progress. So I'll hand it over to you, Ruth, and then we'll follow up with some questions that I'm sure I will have after your fascinating presentation.
Thanks, Daniel. I just have a handful of slides here, and really the purpose of my slides is to kind of facilitate and amplify some of the discussion that we've already had, focused on, what are some of the core major business problems and challenges that our client partners, whether they're providers or payers, are dealing with in delivering quality care at scale, and how do we do that in a way that's meaningful, that's impactful. And then more importantly, I know some of the very important topics that both you and the audience are interested in is how that's been applied real time today during the pandemic. What have we learned? How have we adapted the platform? How have we been agile and really been able to leverage the virtues of a SaaS platform to leverage what was always agile in the past, but on steroids, right, to deliver ongoing value, and what are our learnings and what are some of the trends that we see going forward. So as I mentioned, Force Therapeutics, we're a virtual care platform. We're honored and pleased to work with hundreds of thousands of patients across and have captured over 4 million insights, working with a broad spectrum of providers and payers. Notable names that you all know are organizations like NYU, Yale, Brigham, Scripps. In today's pandemic, when everyone's massively focused on same-day discharge, minimizing the time in the hospital, we also have worked with and continue to work and have developed new relationships with several ambulatory care centers, such as Move, Compass, and others that are focused on how do you optimize that time in the healthcare setting as short as possible. And then over the 70-plus medical research papers that we've published with our client partners, we've been able to substantiate some of the numbers that you see here. Everything that we talk about from a numbers and results standpoint that you see in any of my charts are all backed by medical academic research studies. It has gone through thorough vetting at scale over an extended period of time, and has gone through rigorous review through a variety of medical research boards before being published. And that is part of what has helped us to differentiate ourselves with a litany of health tech options in the marketplace, and because of our clinical finding, which has really been focused on what do we understand are the core business problems and the core challenges that our healthcare providers and payers are looking for to address, and then how do we partner with them with clinically proven efficacy. Our platform offers a variety of comprehensive capabilities that serve the needs and requirements of our payers and providers in delivering virtual care, but whether it's pre-visit, post-visit, post-surgery, non-operative, educate and engage patients in a meaningful way, which has allowed us to, as I had previously mentioned, drive 90% plus patient engagement with an average patient of 67 years old, and then seamlessly integrate with the existing systems that our payers and providers have to already have within their organization, so that we can create that closed loop level of engagement. And the difference of what we're able to deliver is that traditional consumer journey where you may have one visit to the hospital and then a couple of visits throughout that's quite scattered, but the rest of the time you're on your own with a paper trail of guidelines that are not necessarily easy to decipher. And then fast forward that with our personalized virtual care platform that in a very meaningful way and in a very endearing way And all of this we've iterated, failed forward, and improved with all of our medical research to engage patients regardless of age, right, in a way that's meaningful, that's actionable, that gives value to the individual, which is what encourages a consumer to continue to come back. The average consumer touches the platform at least 40 times on a 90-day episode, and then deliver those corresponding insights to our payer and provider partners so that we can drive ongoing care design. I mentioned this earlier, we do this in a way that's fully integrated and seamless from a technology experience for those that are responsible for the technology of our client partners. And so, our goal is always, how do we create a seamless experience? How do we fully integrate so that you can take your back office systems of record and marry that with a best-in-class system of engagement to create that full loop process of insights? What does the patient want? What does the member need? What are the outcomes that we're looking to drive? And how do we create that seamless experience that optimizes patient experience, member satisfaction, reduces leakage, and maximizes the revenue, as well as optimizes the cost efficiencies that our client partners are looking to engage. This is proven in the numbers, right? So average patient and member engagement portals like an EMR usually hover in the 20-30% range. You will, if you do any independent research, you'll see how, consumer apps tend to vary widely in the level of engagement. For us, we keep a gold standard and the bar high that, average patient engagement needs to be, and member engagement needs to be, in the 90s, because it means it costs dollars. It means, less impact, less value, less quality of care, and then, dollars, which is what most of our client partner organizations are obviously focused on. A little bit about our differentiators. All of this is grounded on insights. All of this is grounded on, clinical expertise, grounded on insights, and then the corresponding actions that we take with our client partners to deliver a real-time insights on what's happening, when, where, why, from a member-patient standpoint at any given time, to patterns and anomalies that we see, so that we can be proactive in understanding issues that need to be corrected immediately down to the individual, but then also at scale for continuous improvements to deliver quality of care. And then continue to improve and iterate on those dashboards so that whether you're a payer, whether you're an administrator, whether you're an individual in our organization, client partner organizations that don't actually care for the payer, but for the patient and the member, but need to glean the insights to drive ongoing operational efficiencies and improvements in the system, we're able to empower and drive all of that as well with the real-time dashboards and insights that we deliver as core. We consider this, not a buy-up or an optional part of our platform. We consider it core to our platform, because for us, continuous improvement and continually improving care design is what is core in our mission that we serve to our patients and provider partners. What does this mean from a dollars and cents standpoint? Again, this is backed by some extensive research and studies that we've done. From a payer perspective, in a 90-day episode, these are some stats that give comparative data of organizations that have deep levels of insight so that they're able to optimize member engagement and reduce a lot of the wasted costs in the health system. Readmission, because care was not effectively executed after a consumer left the hospital. A longer than needed length of stay in the hospital because there just was not a close pulse on when a member or a patient was ready to go home. Needing to come back, needing to reschedule, being discharged to the most effective modality of care so that an individual and a consumer can recover safely at the comfort of their home, and doing so in a way that optimizes recovery time. Over $13 million in a 90-day episode, that adds up. It adds up very, very quickly. And, so what does that mean during COVID? What are some of the things that we've experienced? We are pleased that given the high engagement that we've already had in the platform and given the critical mass of patients, members, and client partners that we've worked with, when COVID hit, and none of us could have predicted this at any point at all, engagement on the platform doubled by consumers and patients. And some of this information that we pushed out to consumers were, some information that we had developed at scale, but also we worked closely with our patient partners and our provider organizations to understand what were some of the specifics. So, generic information that is important around reducing stress levels, how to take care of yourself, how to make sure that you eat well and you stay healthy, how do you manage stress when you can't leave the home, right? Those are all things that are really important around the mental health of a patient or a consumer, even if they're specifically dealing with and they're engaging with the platform with a hip replacement or a knee replacement or some issues that they have that require them to go to a hurt surgery for some care, to go to a hospital or surgery for care. But also we were able to also rapidly and overnight develop COVID-related content that was important to our provider partners around, exercises that a consumer could do at the home versus traditionally they were scheduled to come into the office for a PT visit. Some of the anomalies or things that they were seeing post-surgery, and they wanted to communicate real time with their care teams at the hospital on what was happening. Is this a crisis or is this just, I'm okay and I need to take some Advil and follow up on my exercises, right? And so, again, we are pleased given the work that we've done and the studies that we've conducted over the past dozen years to really maximize platform engagement and continue to improve and deliver that engagement during COVID. And so at the end of the day, our mission is very, very simple. As a mission-driven organization, as a health tech that's focused first and foremost on improving quality of care at scale, we are really focused on delivering a virtuous cycle of care delivery for continuous improvement across the entire consumer journey. Deliver care, collect the insights, organize, understand how to apply that in a way that improves the quality of care design, and then learn, iterate, and continue that cycle going forward. It's served us well in the past 10 years that we've been in business, and we have hundreds of thousands of patients, dozens of client partners, and millions of insights that we really appreciate have enabled us to continue to drive that virtuous cycle of care delivery. And so, finally, and this will be my last slide, and I'm happy, Daniel, to answer any questions that you and the audience might have, is, we started with a discussion on some of the grand challenges in healthcare, some of the role of technology enabling meaningful care. For us, as we were looking at partners that could collaborate with us in allowing us to glean insights with incredible accuracy and consistency, with high configurability and flexibility, and with incredibly high standards around security and compliance as a HIPAA compliant, it's a SOC 2 and HIPAA compliant platform. We looked for a partner that had those same three criteria core in their thesis and their business. And we're so pleased with the work that we've done with Looker, now part of the Google family, so that we can leverage those insights to deliver real value to the marketplace. And so with that, I will turn it back to you, Daniel. Any thoughts or comments you've got?
Cool. Thank you, Ruth. That was fascinating. And now apparently my camera just wants to show a cute cat rather than me. I will see if I can't figure that out while we chat. So that is some fascinating stuff. I actually want to start with something that you sort of said in passing that you may not have even realized, but I suspect you have a good answer here, which is that you said that the engagements with the patients, I think you said they have to be effective, but the way that you're doing it also has to be endearing. And I'm totally curious what you meant, and B, how do you actually make it endearing? Like, how do you make your platform endearing?
I use that word intentionally, and I'm glad you picked up on it. And a platform needs to be endearing because the first time a consumer, particularly a consumer that was not born on technology, keep in mind our average patient is 67 years old, views a piece of technology or an application that they're using is creepy, is not personalized, is not relevant, is not simple to use, right, and therefore not endearing, they turn off and they don't come back, right? So, the work that we've done over the past decade was really how do we understand the best way to drive consumer behavior and engage them? How do we design that platform in a way that sticks to the high standards and quality of care that any provider would expect and want out of a health tech partner? And then how do we manifest that in the platform with what the consumer sees, how they see it, how they get nudged to actually use the platform. If you nudge them too often, it becomes a nuisance. If you don't nudge them enough, they forget to engage, right? When you engage them, right? And how you engage them, whether that's, chat, text, via the modality, via the native app, or email, right? Based on their preference in how they want to engage with technology. Those are all the various elements that we think through and that we factored in really developing an endearing platform. Even if you think about the video and the exercises that we offer our consumers and patients in collaboration with our patient partners, we have thousands of videos in our library of information that enables us to deliver effective and efficient virtual care. Some of the very, very detailed and minute studies that we've done in order to make that platform endearing is how long can the video be? How fast do they need to talk? What do the actors need to look like? Where do they need to be on a chair versus sitting on the floor, right? What are all the various ways that we need to, what do the subtitles need to look like? What font, what color, what buttons do they push? Where does it need to be on the screen so that it's easy for a member to engage? Those are all the things that we've, via our 70+ research studies, have really studied and iterated with our client partners on so that we can deliver the optimized experience in an endearing way to our patients and consumers.
I love that. So the idea of being endearing is a data-driven finding, basically, that you sort of knew that the whatever you tried first, and I think this goes to slide 12. There we go. That you knew that whatever you tried first as the way to engage with your patients, whether that was a 10-minute video or a 4-minute video or a video with one tone or a different, chances are that wasn't going to be the perfect ideal video to get people to stay engaged, right? And so then you iterated, you tried different things, collected data, analyzed that data and came to conclusions, it sounds like sort of in a very rigorous way, about what was best to keep people engaged. And it sounds like what you settled on was being endearing.
Absolutely. And using that data in a way that's scientifically applied, right? Not based on gut or feel, not just based on what an AI or ML-based set of technologies would recommend. We obviously use that. That's part and parcel of how we collaborate with Looker as well. But taking a scientific, data-driven, clinically proven, clinically driven insights to deliver that care and continuously iterate and improve.
Awesome. All right, so let's. I feel like I will get yelled at by my colleagues if we don't talk a little bit more about Looker. So let's do that. Let's start as we talked about at the beginning. Let's start with the sort of business problem, right? So, tell me when you realized, or when Force realized that it wasn't just about being able to collect the data, organize the data, and analyze the data inside Force, but also was about turning that data back around and providing it to the providers, to the payers, to the patients, and that was a really important thing that you needed to be able to do. So let's start there, and then we can talk about the process of how you actually implemented that.
Yeah, that realization for us was pretty early on. We had the opportunity to work with a few different data partners before we opted for Looker, and we really, really appreciate the relationship and partnership we've been able to develop with you and your team over time. And we developed that early on because, again, with our clinically founding with our mission-driven and research-focused approach, as we executed the platform, we were maniacally focused first and foremost on the data, what's being engaged, how is the data and the platform being engaged, and then how do we immediately scale forward and iterate, not only for ourselves, but in a way that would deliver meaningful quality of care that our client partners were focused on, right? And so from the very beginning, data was so important for us. But when we had an inefficient way to capture that data, when we had a clunky way to glean the insights, and when it was not real time, then it just added massive amounts of man hours, precious time used by our clinicians, by our researchers, by our development teams to understand what was working, what was not, right? And so that's not only collecting those insights, but doing that in an agile and automated fashion was so important for us. And we've continued to iterate and optimize that as we've taken those insights that were previously just for us to improve and develop the platform, but then, exhibit that to our client partners in easy to digest and easy to action dashboards, executive dashboards, enterprise dashboards, and that could be agile in delivering the insights that would be important by different stakeholders. A surgeon, a care team, a doctor is very focused on consumer engagement as it relates to quality of care outcomes. An administrator, CFO, a payer is obviously interested in that same thing, but applied as it relates to operational efficiencies, reducing the cost of scale, and doing that in a scalable and consistent way. And that's really how the dashboards allow us to not only take insights that we capture on our platform, millions of insights that we continue to capture on a daily basis, but then being able to feed that back on a real-time basis so that our client partners can take actionable, insight-driven actions that are meaningful for them.
So what I heard you describing in your sort of talking through when you decided that giving data to other people was really important was two problems or two challenges that we hear about really commonly from people who are trying to tackle that, right? So one is that it's onerous, right, to actually produce the data, because just because you don't have a system in place for giving that, your providers that data or your payers that data, doesn't mean that they're not going to come knocking on the door and asking for it. They probably are anyway. And so if the processes for doing that are very manual, it's just incredibly time consuming for, your data team, for your engineering team to pull those, to produce PDFs. Like I can't tell you the number of people who I've met where they say, oh yeah, and then 1 week a month is given over to producing reports for our, our partners. And that's a lot of time. That's a quarter of somebody's time, right?
Yeah.
So that's number one, is just the onerousness of not having a sort of automated system in place. But then the second one is I think a sort of very perceptive one that I don't hear about as much, but from the companies that have really gone deep on this and are seeing the most value, I do hear more often, which is that a recognition that it's not a one-size-fits-all thing that you need to provide to people, right? That different users of your data have different needs. And if you put the wrong thing in front of the wrong person, they're going to look at it and say, I don't know what to do with this. And they're going to put it aside and move on with their day. And, that's not great. That defeats the whole purpose. It wastes that quarter of their time that somebody spent pulling that data. And so, that mixture of, we need a system, we need it to be relatively automated and automatic so that we're not spending a huge amount of time producing these reports, but also we need it to be flexible enough to be able to produce different reports for different people that, we can be agile. And as we add new, okay, now we have, insurance companies, their finance department needs access to data. And so, we need to roll with that and give them a particular kind of report or a particular way to slice the data. Okay, now we have the people in our providers' offices who are doing scheduling. And so we need to give them a different view on the data, right? The needs of those two groups are completely different, but they might all rely on that same underlying data. And so I'm curious, like, as you were, particularly as you were making the choice of what technology to use. I'm curious how you thought about those two competing, or not competing, but those two sort of interacting questions of like, how do we make a system that's automated and saves us time, but also remains flexible enough to deliver to all of our different needs?
Yeah, so I cannot agree more that those are not either or, but they're and, right? And they're core of what is absolutely fundamentally important in order for us to be relevant, effective, and sustainable for our client partners. As a virtual care platform, care by definition is always going to evolve, right? Because standards improve, go up, options grow, situations change, right? For example, today, during the pandemic, we're dealing with a set of realities that our consumers, patients, and payers are having to deal with that they've never experienced with at all, right? So, it is not a if or, it is a and when how, right? And so from our standpoint, as we look to leverage insights, make that automated, we are blessed that we have such a strong, incredible team of subject matter experts and clinical team that have evidence-based history, evidence-based insights, given the research work that we've done with our client partners to standardize care, that has allowed us to create a broad and robust set of automated insights and reports that can be delivered real time to our client partners via the enterprise dashboard. At the same time, we also leverage that same clinical team so that as we conduct ongoing research, which for us is a never-ending cycle, right? Continuous improvement is a never-ending virtuous cycle for us. We have the agility and adaptability to pull custom reports, right, for lack of a better word, when it's not quite standardized in the platform, but then immediately weave that into the platform in a standardized way, surface immediately back out to the market, to our payers and our providers so that they can glean those insights to continue to improve that quality of care. Once we feel comfortable, they feel comfortable that it's a standardized approach that's consistent, right? And so it's that virtuous cycle of care. It's the virtuous cycle of improvements that are enabled with a virtuous cycle of insights and data that allow us to deliver that value every day.
Yeah, absolutely. So I don't want to hog all of the question asking because there are some good questions coming in from the audience. And I'll remind everybody that's on that you should feel free to add your question in the Q&A, and then I will pose them to Ruth. So I'm going to start with, I think you mentioned this sort of in passing in your presentation, but I'm curious how you manage HIPAA compliance. I know for healthcare providers, dealing with any data is always sort of starts with, okay, whatever we do, absolutely positively must be HIPAA compliant. And so I'm curious how you thought about that.
Yeah. So HIPAA compliance for us is so important. It was part of our core requirement when we started developing and deploying the platform to our client partners. It's a requirement, right? Our client partners who view patient privacy, consumer privacy, and data so high. One of the number 1, 2, 3 requirements in when they pick technology, not having a HIPAA compliant platform was not optional for us, right? So that was core in our design. We've kept that, we've continually raised that bar. And so not only are we HIPAA compliant, we're also SOC 2 compliant, which requires us to, and there's a rigorous set of analysis requirements, inspections that we've gone through in that process, which is not just around data privacy and security, but also around that full integration process throughout the entire business process of every organization, of every operating unit in our business, and how that gets engaged past to our client partners, to our patient consumers, and then close loop back to the system in a way that's virtuous, that's ongoing, that connects the dots between not just data privacy, but also business privacy and business operational excellence. And so that's, as you're hearing, given our mission-driven founding and our continuous improvement approach, data privacy, HIPAA compliance is just as important and serious for us that we hold ourselves to a high standard every day.
Yep, absolutely. No, that's a great point. That it's not it's HIPAA compliance is the floor, and then there's actually more above that. Yeah, absolutely. So we have a question from Richard, which is, I think, a good one. So specifically, he wants to know, how are real-time dashboards made available to these external users, and do they remain sort of interactive, or are they static?
Yeah, really great question. So our platform has two different views based on what your role is as a stakeholder. So we have a native app, web responsive app, a native app as well as a web responsive portal that patients and consumers can access for their virtual care, for their connection to their providers, and a whole set of interactive dashboards and gamification for them to see what they're doing, how that results in their improvement in care. Those same enterprise dashboards in a different lens are made available to our providers and payers via the provider app, right? And so those from a provider view are more around what is the aggregate view of scale and quality and impact on those dashboards across hundreds and thousands of patients, how they compare to their cohort in the industry, how the heat map of engagement of consumers from a geographic difference standpoint, how that all connects the dots from a care quality and cost standpoint, right? And so those are all part of the app. They're not buy-up modules. When the provider or a payer logs on to the app, or a patient and consumer logs on to their version of the app, they are able to see those dashboards in an interactive basis as they leverage the platform.
Very cool. That is very neat. So I think maybe we've got time for one more, and I think there's a good one from the audience, so I'll go there. So, we're just curious, sort of, what are the biggest learning curves that you and your team and your whole company have faced implementing an embedded platform, in this case, powered by Looker?
Yeah, so some of the biggest learnings that we've faced in developing, deploying, and improving a platform that delivers meaningful value around virtual care and patient engagement is always remembering, first and foremost, delivering that personalized, seamless consumer experience, but having a straight line feedback loop to our client partners on what's working, what's not. And then iterating on that early, often, continuously, right? Our research-driven focus allows us to do that as just part of our core DNA, but having that embedded in an automated and a virtuous cycle in the platform, and in a way that still delivers that endearing experience for the consumer, as well as the real-time insights for our client partners, is not a simple feat, right? It requires really the coalescence of all of our operational teams between engineering and product, our client success and clinical teams. And so that on an ongoing basis, we are keeping first and foremost at top of mind quality of care, impact, value, and do that in a way that still maintains the integrity of the platform as a HIPAA compliant SOC 2 with the highest levels of patient privacy and security.
Yeah, no, I love that sort of reminder that doing a project like this requires sort of collaboration and buy-in across the whole organization. It's not a thing that can live with just a data team or just an operations team. It's something that really the whole team has to come together around. So, Ruth, thank you so much. This was a fascinating conversation for me. I hope everybody else on the line found it as fascinating as I did. And thank you also for rolling with the technical difficulties. I'm told by a little bird that you handled it beautifully, even though I couldn't see you when you were doing that. Thank you, everybody, for attending. Just a reminder, we will send you a recording of this conversation probably tomorrow or in the next few days. If you want more resources, you can check out info.looker.com or our blog. You can find upcoming events or get a demo of what Looker can do for you. And of course, you can check out Force Therapeutics if you are in the market for an amazing solution to help people, heal and get better in these very challenging times. So thank you again, Ruth, so much. Thank you, everybody, for attending, and have a great day.
It was my pleasure. Thanks so much. Have a great day.